Hi everybody, welcome to another installment of the Champaign County Healthcare Consumers Healthcare Fact Chat. Today we are talking about the just newly released healthcare bill known as BICRA. We don't know what that stands for and we don't care, but we're going to be talking about it today. My name is Claudia Lennhoff and I'm the Executive Director at Champaign County Healthcare Consumers, and I'm joined by
Adani Sanchez, Client Services Coordinator at Healthcare Consumers.
Adani, can you give a very brief overview of BICRA?
So BICRA is a manual on how to murder Medicaid.
Okay, there you have it. That's what the Senate's healthcare bill is about. How to murder Medicaid and get away with it. But we're going to talk about the bill in a little bit more detail, but not comprehensively. It just came out. There's a lot of nasty things in the bill still to be figured out. But we're going to talk about some major areas. But just to put things in perspective, really, Adani, I wanted to ask you, is this bill better for anyone than the Affordable Care Act?
So this is going to be better for billionaires and billionaires who are also very young and looking for health insurance.
Okay, so from a health policy perspective, this bill is not an improvement on the Affordable Care Act. And also, before we get lost in some policy detail, because you're going to be hearing a lot about how this bill is an improvement over the House bill or how it's better in certain ways, but we really have to keep this in perspective. So before we get lost in some policy detail, I feel like we need to remind everyone that the absolute core of this bill, like the House bill, is to move hundreds of billions of dollars from subsidizing health insurance for low-income people to cutting taxes for the rich. This bill takes health care from lower-income people and makes it into capital gains tax cuts for wealthy people and wealthy pharmaceutical and insurance companies. And we cannot lose sight of that. We'll come back to these massive tax cuts for millionaires and how Medicaid is being slashed to pay for it in a little bit. But before we get on to the Medicaid cuts, let's focus on some of the other areas that people may be hearing about.
Yeah, so you're going to hear about the changes in the subsidies. It's going to look a little bit more like the ACA with how the subsidies are structured, but it's incredibly less generous. They're going to change what kind of coverage people can get on the marketplace. So now the kind of value of the plans that people are going to be able to get is actually drastically reduced.
The actuarial value,
right,
which under the Affordable Care Act is set at 60%.
Correct.
Which means that any insurance plan in the marketplace needs to, on average, cover at least 60% of your total health care costs. And now they are lowering that?
They are lowering that down, which means that people are going to be paying more out of pocket.
That's called cost shifting. They're just making you responsible for more of the cost of your health care.
Your premiums might go down,
yeah,
but you're paying for less coverage now.
Okay. And then what is happening with the essential health benefits? Because we know that the essential health benefits, besides the affordability of health insurance, the essential health benefits really speak to the comprehensiveness of that coverage, what types of services are covered. Because if something is not part of the essential health benefits, like maternity care or mental health services, then the consumer is left paying for that completely out of pocket. So
exactly.
What's happening
So
there?
they are writing into this, they are going to strike out essential health benefits from Medicaid. That's devastating, again, to people who are low income and who might need services like maternity care and mental health, who are on Medicaid. And it still protects the waiver. So in the House bill, there were waivers where states and insurers could apply to get waivers from what could be considered an essential health benefit. And that is still in the bill. A lot of senators are going to be really excited to tout that now that the waiver allowing people to charge people with pre-existing conditions more, they're going to be really excited to say that that got struck out. And it did, but when you still leave in that ability to apply for a waiver for essential health benefits, you're still hurting people with pre-existing conditions. So that is not actually helpful.
Right.
They just took out the language that explicitly says people with pre-existing conditions can be charged more.
So now under this bill, if you live in a waiver state, if you're a person with pre-existing conditions, you will be charged a community rating, so you'll be charged the same as maybe somebody else who is similarly situated, but the health plan that you get may not cover the services that you need for your pre-existing condition. So for example, if you need a lot of lab services to monitor your diabetes or your cancer or whatever it is, if that's not included in the essential health benefits for your state, you might be left paying for all of that out of pocket.
Which is effectively a charge for people with pre-existing
Right.
condition, because you have to come up with that money now if you want to get that care.
Right. So it's some fancy footwork to sort of make it seem like they're taking care of people with pre-existing conditions and they won't get charged more. They may not get charged more for their health insurance, but they certainly will get charged more by having to pay out of pocket to get the services that they actually need. And we know that people, if they can't afford services, they frequently withhold that care, and then things get worse.
Yeah, which leads to more expensive care in the emergency room, which drives up prices for everyone, regardless of what kind of health insurance you have.
Great. What else do we have, Adani?
This bill does not do anything about, so it removes the individual mandate, which was something that people really hated, but it really doesn't do anything to kind of otherwise encourage healthy people to sign up for health insurance, which may lead to, again, highly motivated sick people signing up for health insurance and being the only people left in the pool, kind of.
Thereby driving up the cost of health care for everybody because you don't have a good risk pool.
Right.
Great. Okay. Do you have any other thing you wanted to highlight?
This bill does still cut funding for Planned Parenthood. Federal money does not go to abortions, no matter what. But this bill, for some reason, still includes a provision where even though Planned Parenthood is providing other services and getting paid by Medicaid to provide these other services, like preventive screenings and stuff like that, they're still being cut out of Medicaid payments for 1 year. So that still got kept in there.
It's almost like the Senate Republicans who were involved in crafting this bill hate women or hate family planning or don't understand health insurance or don't care for 20% of the American population that benefits from Medicaid. It's almost like that. So speaking of Medicaid, let's talk about the Medicaid cuts, because this is really what should be the lead story on this bill. No matter what you hear about pre-existing conditions in the marketplace and insurance pricing and subsidies, the lead story really should be, just like with the House bill, what happens to Medicaid cuts. The Medicaid cuts in this bill are really insidious. They are actually designed to get bigger every year, so they are actually worse than in the House bill. Beyond the period of, so these cuts will actually get worse over time, even beyond the period of time that the CBO looks at this bill and scores it, because the CBO sort of has this 10-year window. And under this plan for what they have for Medicaid, it's going to get worse and worse even beyond those 10 years. They're going to end up strangling the program. So right now, just as a reminder, the way that Medicaid works is that it's a guarantee. If people need health care, they have Medicaid, the federal government matches the state's spending, and the bills are covered. Under this plan, states get a fixed cap amount per person, and if the need grows, the money doesn't. So if all of a sudden your state has more people who are low income and uninsured because of a downturn in the economy, that pot of money from the federal government is not going to grow. One thing we know is that medical costs grow faster than general inflation. But this Senate bill ties the increases to the caps, the Medicaid caps, to the general inflation rate, not to the medical inflation rate. So what that means is that over time, states are going to lose money on Medicaid.
Because it's not going to keep up.
That's right.
The healthcare spending is actually, it's going to cost more to keep those people covered, and the money that they're getting for all of those people is increasing at a very slow rate, versus the actual cost that they're seeing.
Exactly. So these huge cuts to Medicaid will get worse every year, and even worse during health crises, if there's an outbreak of Zika or something. Let's talk about what will happen to state budgets. as a result of that. State budgets will be crushed. I mean, we don't happen to have one, but in
hypothetically speaking, if we had a budget,
Yeah.
it would be crushed.
Yeah. State budgets will be crushed. As federal Medicaid dollars disappear, states will slash funding for schools, roads, public safety. The impact is going to be far-reaching. With regard to the Medicaid expansion, that's part of what's being cut. So I just want to talk about that for a moment. In the state of Illinois, we are actually one of 8 states that are considered trigger states. And what that means is that when we passed our Medicaid expansion bill, we had a trigger provision in the bill that says that if the federal match rate drops below a certain percentage, we get out of the Medicaid expansion.
It ends.
It ends. So Illinois residents will be among the 2.7 million people in these 8 trigger states who lose their coverage immediately in 2020, January 1, 2020. If you have Medicaid by virtue of the Medicaid expansion, you, under this bill, will lose your coverage January 1, 2020.
And they're going to try to say that this is over, hey, nothing's changing in these other states, it's not going to happen, it's not going to take effect until until later, these changes aren't going to take effect. But in Illinois, it's going to be very immediate, and a lot of people are going to lose coverage for it.
It seems like a big factor in the calculus for the Senate, members of the Senate who came up with this bill, is that there may be a little politically more savvy in terms of thinking about their re-election campaigns, and so they spread out the hurt over a longer period of time.
They call it a soft landing, but it's really a soft landing for them.
Yeah.
To get through elections.
Yeah, it's exactly. It's their soft landing. So we have a lot of statistics on Medicaid. I guess one of the things that I just wanted to mention was in terms of long-term care costs, because a lot of times people don't think that it applies to them. But in terms of long-term care costs, 2/3 of those costs are for Americans living in nursing homes who have Medicaid. Medicaid pays for 2/3 of long-term care costs. Many of them are middle-class Americans who spent down all of their savings on health care becoming eligible for Medicaid. That can happen to any of us. Even if we never had to rely on Medicaid throughout our life, one really devastating illness or later, with the onset of aging and illness, people could end up needing Medicaid to cover their long-term care costs. And I just wanted to mention some statistics again, because again, you're going to be hearing a lot of details about this bill, but we can't bury the lead. The lead is that this bill, although it's supposed to be an Affordable Care Act repeal and replace, really is about killing the Medicaid program, and about killing it probably for ideological reasons, but also for practical reasons of funding huge tax cuts for the very wealthy, hundreds of billions of dollars in tax cuts. 1 in 5 of all Americans have Medicaid coverage. Medicaid covers 49% of all births in the United States. Almost 2/3 of all nursing home residents are covered by Medicaid. 40% of all low-income adults are covered by Medicaid, and it would be higher if certain states, like our home state of Texas, had done the Medicaid expansion. 30% of all adults with disabilities have Medicaid coverage. 39% of all children have Medicaid coverage. 76% of all low-income children have Medicaid coverage, and 60% of all children with disabilities have Medicaid coverage. We can't let them get away with this.
This is devastating. This doesn't even take into account, just if you don't care about the people who are losing their coverage, the unforeseen consequences of how this would affect our healthcare industry as an economic powerhouse. I mean, this is absolutely devastating.
Yeah, this is devastating, as Adani said, and it will bring about a humanitarian crisis, and not just in terms of healthcare. It will start with healthcare, but the ripple effects will continue beyond that. We have to stop this. The one action recommendation that I can give for people who live in our community or who live in the state of Illinois, we have senators who are very good and have vowed to oppose this bill. But I think an important voice from the state of Illinois is missing in action, and that's the voice of Governor Rauner. We need Governor Rauner to feel some pressure to be moved to speak against this devastating bill. Governor Rauner needs to join the other Republican and Democratic governors who have said that our state will not survive this bill and it's unacceptable, and these Medicaid cuts are absolutely unacceptable. So we've laughed a lot because otherwise we'd be crying and raging and throwing things. So, yeah, flipping desks.
Flipping everything.
This is just insane. So, thank you for bearing with us. We will probably, in the days to come, have more information. The CBO score, I believe, is expected on Monday.
Yep.
And then next week, Thursday, the 29th.
Is when they expect to vote on it.
Yeah.
So it's moving very quickly, so pay attention, keep an eye out. We'll try to get information.
Yeah. And if you're tired and fatigued and just, please find the energy to rally and to take action. We can't give up now. There is way too much at stake, and we need to kill this bill in its tracks.